Do you have osteoporosis, the silent disease? We've all seen it, both in popular culture and in real life, the frail, elderly woman with a hunched back and a cane. It's a tired stereotype, but for far too many women, this is how osteoporosis can manifest itself if it's not prevented or detected early. Although osteoporosis can affect anyone of any gender at any age, according to the Centers for Disease Control, the disorder affects 10% of women in their 60, 27% of women in their 70, and 35% of women aged 80 and up. What exactly is osteoporosis? The term osteoporosis literally means porous bone. It's a condition that causes thin, weakened bones, making them more prone to fractures. It is often referred to as a silent disease because there are usually no symptoms until a bone is broken. How does osteoporosis develop? Our bones may appear to be as solid as a rock, but they are actually living tissue. Your body is constantly destroying old bone tissue and replacing it with new. This healthy bone tissue resembles a honeycomb under a microscope. The production of new bone tissue begins to slow around the age of 30. Your body will gradually break down more bone tissue than it replaces. As a result, the honeycomb's holes grow larger. This weakens bones, making them more brittle. You have osteopenia if your bone density is low but not low enough to be diagnosed as osteoporosis. Through diet, exercise, and other methods, your doctor will work with you to slow the progression of the disorder before it progresses to why is osteoporosis dangerous? Bone fractures can cause painful, incapacitating, and costly medical problems. Osteoporosis fractures are most likely to occur in the hip, spine, or wrist, but other bones can also break. The bones also soften. This can eventually lead to chronic discomfort, reduced height, and a hunched or stooped posture, particularly when osteoporosis affects the vertebrae. Limited mobility can result in feelings of isolation or depression. Long-term nursing home care is required. Furthermore, 20% of seniors with broken hips die within a year, either from complications related to the broken bone or from surgery to repair it. As the U.S. population ages, the number of people suffering from osteoporosis fractures will increase. According to the National Osteoporosis Foundation, osteoporosis causes 2 million broken bones each year, and experts predict that by 2025, there will be approximately 3 million fractures and $25.3 billion in annual costs. What are my chances? These factors increase your risk of osteoporosis. Gender: women are more vulnerable than men. Aging: the greater your risk, the older you are. Menopause: menopause causes hormonal changes, such as a decrease in estrogen. In younger women, estrogen protects the bones. Your physical structure: women who are thin and small boned are more vulnerable. Ethnicity: Caucasian and Asian women are more vulnerable, owing to differences in bone density. However, African American and Hispanic women are still at risk, albeit at a lower level. Certain medical conditions: rheumatoid arthritis, type 1 diabetes, premature menopause, and anorexia nervosa are just a few of the conditions that can harm your bones. Medications: some commonly used medications can cause bone mass loss. These are some examples. Glucocorticoids, a type of medication used to treat diseases such as arthritis, asthma, and lupus. Some anti-seizure medications, hormones that release gonadotropins, endometriosis treatment. Aluminum-containing antacids: calcium absorption is hampered by aluminum. Some cancer therapies. Too much thyroid hormone replacement for an underactive thyroid. A family tree: if you have a family member who has osteoporosis, your risk increases. Prior fracture: people over the age of 50 who have had a fracture are at a high risk of having another.